It's been a week since the U.S. government released a 15-day pass guideline to slow the spread of COVID-19. Meanwhile, the figure is still soaring. Over 30,000 of COVID-19 cases were confirmed as of Sunday afternoon. Tougher restrictive measures have taken across the country. Now, at least 8 states have issued stay-at-home orders, asking people to stay at home as much as possible, and some other non-essential businesses to close. The United States also announced travel restrictions on its southern and northern borders with Mexico and Canada, which came into force over the weekend. Those limits on travel, going into work, and activities in public spaces have put the economy on virtually lockdown. The downstream effect of sharply lower spending is likely to soon result in job losses. Wall Street just finished another brutal week with massive losses as investors grappled with fears over potential economic damage by the coronavirus pandemic. California Governor Gavin Newsom announced a statewide stay-at-home order last week for the most populous U.S. state. That means nearly 40 million Californians were asked to stay home unless it is absolutely necessary to head out. The governor said the decision is based on modeling projections that 56% of the state population will get infected over the next 8 weeks, with a gap of some 20,000 hospital beds for coping with the situation, and with Los Angeles, the second largest U.S. city, to be severely hit. New York is the hardest hit state of COVID-19 in the country. The state could need 110,000 hospital beds when the peak infection comes in around 40 days, which would be more than double its current capacity. Some 37,000 ICU beds could be in need, while the state currently has 3,000. Besides hospital beds, masks, surgical gowns, and eye gear are also in dire shortage. Health and Human Services Secretary Alex Azar testified before senators in late February that the country has 30 million N95 respirators in the strategic national stockpile, and that it needs 300 million for healthcare workers. Xinhua correspondent reporting from Washington, D.C.